Now, the other aspect that I discussed with this client was getting just like baseline lab values, just having a really good idea of how she's doing internally. And regardless of how advanced you are, I do think you need this baseline. And I think it's something you need to continue to take. And depending on what comes back, it might be something that you need to get checked a little more regularly. But I would get your labs done. You do want to see liver enzymes, kidney function, lipid profile, blood pressure, and if there's hidden hypertension or even poor cholesterol, introducing PEDs can accelerate these issues. And I don't see this largely with female clients, but I do see it heavily with men, that they'll be like 130 over 80, 140 over 90, and they'll be like, can we start TRT? Can we add Anavar or Mastron into my current cycle, which would really just be TRT. So anabolics in themselves, are they going to make blood pressure worse? Well, it depends. If you are already, let's say, leaning towards having very stiff arteries, if, let's say, you are using a lot of stimulants that are causing a very strong like pump and contraction of the heart, if you have plaque buildup, if you have any kind of dyslipidemia, if you have high degrees of circulating glucose, like these are all things that not just with anabolics, I want to say, like, I want to look at, because I want to know what is the true actual, like as clear as I can get, what is the risk of putting this in place? Because for some people, even the non-androgenics are ones that we shouldn't really fuck with. It was wild how this happened, but I had two clients, this was a couple years back, both had pituitary adenomas, both wanted to use growth hormone. And I remember telling them, I'm like, we can't do that. You have like quite literally what could be a brain tumor. You have a mass. And even though it's reasonable right now, if you add this in, even if you add TRT in, like this in itself, like I'm not comfortable telling you to put this in place because right now this isn't an issue. But you are going to have this the rest of your life. Like we're not going to be able to remove it. And maybe it's best that we don't. But realistically, if we're putting things that have excessive growth factors, or not even excessive, just are going to encourage growth factors, we have to understand that for anything that is cancer related, anyone who's at risk of cancer, we are encouraging that development. We're causing cellular turnover at a super physiological rate. So even though GH and like growth hormone peptides, they in themselves are not cancer causing, they could very well be cancer accelerating. So globally, just looking at comorbidities, making sure we have an understanding of like, what is the trajectory if we put this in place? And I like to think of it almost like not just like doing this cycle, but what if we do this cycle and then in a few months you want to do it again and you want to do it again. And let's say you do 3 more cycles. How much closer are you to having a system disorder? How much closer are you to needing medical intervention? And realistically, even things like blood sugar, blood pressure, they can sneak up on you and they can be very, very silent kind of in the background. So I would have a baseline understanding of what your risk profile is, just you personally, but then also family history, and then understand if you're going to use PEDs, how those PEDs can alter, whether it be heart rate, blood sugar, blood pressure, and which ones could be downright dangerous depending on the severity of the comorbidity. I have another client who just checked in yesterday. We're talking about thyroid hormone in a more of like an HRT sense, but there's also concerns about her testosterone. And even though she's expressed not a big fan of needles, but I could very well be open to doing injections, really what gets me are the blood draws. Like how often would I need to go in to get my blood drawn? Like, do you think it'd be more than once a year? And this isn't black and white. I can't say even with this client, I've really decided whether or not TRT would make sense for her, but it is a consideration that like if getting blood drawn and getting labs done regularly is going to be a problem, if that individual is going to be traveling a lot, if they can't afford it, if they're not going to be consistent with going to the appointments, that would also be a consideration, because it's not like you need to get labs checked like every week or even every month, but especially with something like TRT, I'm like, we need to know how well it's working. We need to know what it's doing and whether or not we need to adjust the dose. So for her, I'll probably end up just explaining like, here is generally what like first year on TRT would look like. And then once we have your dose, here is how that would look. But realistically, it's probably not as bad as she's imagining, where I think she is considering it like, oh, I'm going to have to do this every month, which wouldn't really be the case. However, if we were to start we would need to get labs checked 5 weeks after starting. And let's say that dose was not high enough or was too high. I'd probably want to get labs checked again another 5 weeks after that. So that could seem like a lot, especially in the case she just got her panel done. Get them done 5 weeks after starting TRT. After that, if we need another panel done, okay, another 5 weeks, that could be 3 panels in the course of 3 months. And that very well could be a tipping point where she's like, I'm not doing this. And if that's the case, we need to understand that, because that should guide our decisions around PED use. Another thing that I'll say about health is when we're talking about oral anabolics, so like Anavar, oral anabolics can heavily impact the liver. So if you already have elevated liver enzymes, you do need to be cautious. If you're on medications that cause liver elevation, hepatic dysfunction, this is something we should consider. If you're having trouble lowering these enzymes, even with medication in place or over-the-counter supplementation, I would be very cautious about starting an oral anabolic cycle. But bottom line, if you can't be bothered to check your current health status, if it's something that you're just like, I don't see the value in it, or maybe you see the value, but you're just like a little too lazy, you're not ready for PEDs. They can stress your organs and they can have deleterious effects. And best case scenario is you're in a place where hormonally you can't really even take advantage of them, but that is something that I will get to in the next section. Best case scenario, you put it in place, but hormonally, you're not in a position where you can fully take advantage of it.